Hello, and welcome back to our channel. In this video, we will be discussing 49ers quarterback Brock Purdy's season-ending elbow injury. Before we get into today's video, be sure to hit that subscribe button down below. We post daily videos and aim to educate our audience on the world of sports medicine. Brock Purdy, a quarterback for the 49ers, suffered a torn UCL during last night's NFC Championship game against the Philadelphia Eagles. After updates, we have now found out the injury will sideline him for at least 6 months. He still awaits a decision on whether surgery will be required. The injury was caused by a defender pushing Purdy's forearm backwards, which put a lot of stress on the medial or inner portion of his elbow. This is known as a forced valgus stress on the elbow. The stress put on the elbow can potentially injure one key ligament, some muscles and tendons, and potentially a nerve in this area. The elbow ligaments are already under a lot of stress with any sort of throwing motion, such as football, baseball, or javelin. In this specific injury, Purdy's elbow is bent in a position where it is forced to go further back than it naturally wants to go, which can strain the inner structures of the elbow. Injuries like this are similar to when Josh Allen had his elbow injury where he suffered a UCL strain. The flexor pronator muscles on the inner or medial portion of the elbow, along with the underlying ulnar collateral ligament or Tommy John ligament, and the ulnar nerve are the main structures that can be affected by this type of injury. The flexor muscles are important for bending the wrist upwards and flexing the fingers, and they originate off of the inner portion of the humerus called the medial epicondyle. These muscles and tendons can become strained, which would have been the best case scenario for Purdy. The ulnar collateral ligament is the Tommy John ligament that is commonly heard about in baseball players. It has 3 components: the anterior bundle, the posterior, and the oblique bundle. The anterior bundle is the one that is most commonly torn with a bad UCL injury. A manual stress test is used to test for an elbow UCL injury, which mimics the position that Purdy's elbow was put in during the injury. The test is done by holding the elbow out in front, putting a little bit of flexion, and then applying a valgus load to see how much pain and instability is present. Another concerning part about this injury is that studies have shown that the UCL anterior bundle is under the most stress around 50 to 90 degrees of elbow flexion. This is the area where Purdy's elbow was when he was throwing the ball, which puts the UCL at risk of being injured. Additionally, the ulnar nerve is also in this area and can be hit if the inside of the elbow is bumped. This can cause temporary injury to the ulnar nerve, known as the funny bone nerve. The ulnar nerve travels in a groove called the cubital tunnel and can sometimes dislocate and pop out over the medial epicondyle, becoming irritated. In summary, this was a super unfortunate injury for the rookie quarterback who was having a sensational season up to that point. We wish him a speedy recovery on his journey to getting back on the field. Thanks for watching, and we will see you next time.